Occupational English test. Listening test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Please have a seat.
Good morning, doctor. This is my son.
How can I assist you today? What seems to be troubling him?
He has been having high fever spikes, severe headaches, and sometimes he feels very cold. I'm quite worried.
That sounds concerning. Has he traveled to any areas known for malaria recently?
Yes, we just returned from a vacation in a tropical country last week.
Okay, does he experience any nausea, vomiting, or muscle pain?
Yes, doctor. He has been vomiting and complains of muscle pain and fatigue.
How old is he?
He is 8 years old, doctor.
Has he had any prior medical conditions or hospitalizations?
No, doctor. He has been generally healthy.
Is he currently on any medication?
No, doctor.
Any known allergies to medications?
Not that we are aware of, doctor.
And his immunizations are up to date, correct?
Yes, they are, but we didn't take any anti-malarial medication before traveling.
I see. Based on his symptoms and recent travel history, it is prudent to test for malaria. He has been showing classic signs, such as cyclic fever, headaches, and muscle pain. I would recommend a blood test to check for the presence of malaria parasites.
All right, doctor. How soon can we get the results?
Usually, it can be done within a day. If he does have malaria, we will need to start him on anti-malarial medication immediately. Chloroquine is commonly used, but the choice of medication will depend on the species of malaria parasite causing the infection and its drug resistance pattern.
Is the treatment long, and will he need to be hospitalized?
Treatment duration can vary, but it is usually for a few days to a couple of weeks. Hospitalization may be needed if the infection is severe, but if detected early, outpatient treatment can be effective.
What about after the treatment? Will he need follow-up tests?
Yes, after the completion of treatment, we will need to do follow-up blood tests to ensure that no parasites remain in his blood. Additionally, he should continue to use mosquito repellent and sleep under a mosquito net to prevent reinfection.
Thank you for the detailed explanation, doctor. We will get the blood test done as soon as possible.
You're welcome. Let's act promptly to get him treated effectively. After the blood test, we will discuss the treatment plan based on the results. Take care and don't hesitate to call if his condition worsens before the test results are out.
We will, doctor. Thank you again for your guidance.
Extract 2, questions 13 to 24. For questions 13 to 24, Complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. Please have a seat. How can I assist you today?
Good morning, doctor. My child has been feeling unwell, showing some rash and has a fever. I am really concerned.
I see. How old is your child?
He is 5 years old, doctor.
Has your child been experiencing any cough, runny nose, or red eyes?
Yes, doctor. He's been coughing and his eyes look a bit red and watery.
Has he been exposed to anyone who had a similar condition or anyone with measles?
Not that I am aware of, doctor.
Has he received his MMR vaccine?
No, doctor. We haven't vaccinated him yet.
Does your child have any history of previous illnesses, allergies, or any medical conditions?
No, doctor. He's generally been healthy.
Does your family have a history of any immunodeficiency diseases or any other chronic conditions?
No, doctor. Everyone is in good health.
All right. It seems like your child is exhibiting symptoms consistent with measles. I will have to order some tests, including a blood test, to confirm the diagnosis.
What kind of treatment will he need, doctor?
Measles is a viral infection, so there is no specific antiviral medication for it. The treatment mainly focuses on relieving symptoms, maintaining hydration, and preventing complications. If it is confirmed that he has measles, I will recommend bed rest, plenty of fluids, and fever-reducing medicines like acetaminophen or ibuprofen to control the fever and muscle aches.
I would also advise keeping your child isolated to prevent the spread of the virus to others, especially to those who are not vaccinated or have a weakened immune system.
Yes, doctor, I understand. Is there anything else we should do?
If the measles is confirmed, vitamin A supplementation may also be recommended, as it can help in reducing the severity of measles, especially in children with low vitamin A levels. Additionally, ensure that he receives balanced nutrition to support his immune system. Once he recovers, I strongly recommend getting him vaccinated to prevent future occurrences of measles and other preventable diseases.
Please remember that complications from measles can be serious, such as pneumonia or encephalitis, so monitor him closely and bring him in immediately if his condition worsens or if new symptoms develop.
Thank you, doctor. I'll follow your advice strictly and I'll ensure he gets the vaccine once he's better.
That sounds good. Please keep me updated on his condition and don't hesitate to call if you have any concerns or questions.